Family First Intervention has 4 services. 3 of them are the interventions. So we have an alcoholic intervention, in other words, interventions on alcoholics, interventions on drug addiction, then of course interventions on mental health and/or dual diagnosis. And before I go any further, all my alcoholic interventions and drug addiction intervention are presenting some type of mental health symptoms. So in theory, we're doing interventions for mental health and dual diagnosis. And then the SAFE, self-awareness, family education, family aftercare program, which is a huge component of our intervention process and services. Because after the intervention's over, this is where the family joins a recovery team. And what we offer is completely different than what most interventions have or are even capable of offering. So in terms of an intervention for drug addiction, it's not very different than any other intervention because the intervention is the instrument and or the vessel that brings your loved one to an integrated treatment center that's based with dual diagnosis professional. But the biggest difference is that alcoholics and addicts not only separate themselves, but their families do too. Because alcohol is legal and socially acceptable. And a lot of times with alcoholics, we hear the term functional alcoholic. We very rarely hear the term functional drug addict. There's not a lot of functional meth addicts and functional heroin addicts. There are some watching this may have one. But when we look at drugs, we think of it in a completely different light. You know, even people who are alcoholics, they look down on drug addicts, and people who are drug addicts, for some reason or other, they look at alcoholics differently. So the whole point of the different services is it's the approach in which of the person and where they're at in their life and what substances they're using. And it's also about what the family's being put up with. I mean, families of alcoholics have a different set of problems than those of drug addiction. But at the end of the day, both sides are self-medicating. Both sides are ripping through the family like a tornado. And both families probably have had enough and need to learn how to enter their own recovery program. So if your loved one is using drugs, especially something like opioids, where the risk of overdose is so high with things like fentanyl that's put in it, it's very, very important that you seek help as quickly as possible so you don't lose your loved one to the drug addiction.